Hi, Dr. Saman. It's so great to talk to you after such a long time.
Likewise, thank you for having me.
Yeah. Dr. Saman is a occupational and environmental specialist in the United States. And I thought it would be interesting to talk to you because it's something very unique. Not a lot of doctors do that kind of thing. So it's not something a lot of doctors know much about. I don't know much about occupational medicine or environmental exposures. As part of my integrative medicine course, we talked about it briefly, but I have a feeling you probably know a lot more than I do. So, what do you wanna what would you say is the best place to start with environmental exposures?
Yeah, it is a bit of a niche specialty, and as the name suggests, it mostly deals with exposures in the workplace, in an occupational setting, and then also just general environmental exposures, heavy metals, air pollution, climate change, heat exposure, and things of that nature. We can start with some of the major issues in the news that we've been hearing recently, if that works for you.
Yeah,
Particularly recently with uh, contamination in whey protein and dark chocolate, especially with regards to heavy metal.
yeah, I've heard of the dark chocolate thing quite a bit. I hadn't heard of the whey protein thing. So, whey protein, what is that supposed to be contaminated by?
Same thing as dark chocolate with heavy metals. Consumer Report actually came out with an article this year, similar to their articles last year with the dark chocolates, or I think maybe it was 2 years ago.
Right, right. And which heavy metals is it?
Mostly lead and cadmium, a little bit of arsenic, but the focus was mostly on lead and cadmium.
Okay, I guess the main thing I would ask is how does this come to you? How would you see this kind of thing?
So in the clinical practice, we haven't had any cases of poisoning from dark chocolate or whey protein yet. We usually get cases for other types of exposure. Now, lead, people can be exposed through a variety of different sources. It can be through food, like we talked about, dark chocolate, whey protein. These are some of the newer ones, but previously more well-known and research sources are herbal supplements, Ayurvedic medicine, some traditional Chinese medicines, cosmetics. A couple years ago, 5, 6 years ago, there was a big case about turmeric being imported in the US from South Asia that was tainted with yellow pigment, and people were developing lead poisoning from that. But apart from that, it's not just food sources. It's also old homes, particularly old leaded paint, lead pipes, and then people in the firing range, people who like to go and practice shooting from lead bullets, there can also be exposure. So, and then also you can get exposed through the soil. So really a lot of a wide variety of sources. And in the clinic, to answer your question, when we deal with lead poisoning, some of the cases that I've seen have been from people who have practiced in the firing range. In some cases, from lead pipes and workers, uh, construction workers, particularly dealing with lead paint.
Hmm. Okay, so obviously you'll get a lot of your history just by asking people, the questions about these kind of, what environments they're in and what kind of exposures they could have. Symptoms wise, is there anything you would be looking out for?
So really, when we talk about heavy metal poisoning, the symptoms are so vague: chronic fatigue, peripheral neuropathies, anemia, constipation, things like that, that usually can have, that we see in primary care practice all the time. I'm sure you see it all the time as well. And usually these symptoms have much more common causes: diabetes, high blood pressure, anything can cause these symptoms. So heavy metal is really not the first thing that comes to mind. For patients and for practitioners, what I would recommend is, instead of jumping straight to heavy metals based on symptoms, consider heavy metal poisoning based on exposures. So
Mhm.
if you take a history and you see that there is exposure to leaded paint, someone is dealing with that, or they're a hobbyist and they're in the firing range and then they have these specific symptoms, then go down the road of testing and really considering it as one of your differential diagnoses.
Yeah, that's a good point. I don't think I've ever asked anybody how old their house is, which is probably a very relevant question. Um, so yeah, that's a good point. I think when you said about the environmental exposures, um, you're talking about, chocolates and food, and and I was aware that, certain herbal supplements can be quite a problem with the ones that are coming in the news a bit more now, the dark chocolate and the whey protein. What is there a potential that they could cause problems as well?
It really depends on the level of exposure. Consumer Report came out with a great article where they tested various chocolates and whey proteins. So some of them are in such high concentration, some of those brands, that even if you're taking a few servings a week, then you're beyond that threshold, that safe threshold that they recommend. Ideally, lead level should be zero in the blood, but there is a general kind of safe threshold that we have. While other chocolates and whey proteins, if you're taking two or three, even four servings a week, then that's fine. So it really depends on the brand and how much you're consuming.
Hmm. Okay, yeah, that's interesting. And are the reference values for safe levels, are they consistent throughout the world? Does everyone agree on a safe level?
So it really depends on which type of exposure we're talking about. And that is a very good question, especially in an occupational setting. In an occupational setting, we find that there's a much more common consensus just because the exposures are generally so high that it's more well studied. And something like lead, which has been the risks of which we've been aware of for decades now, those levels are pretty well established. We have different guidelines for pregnant women, for children, and for adults. Something like cadmium, we look at much, much more in an occupational setting. In the general population, we don't really see that as much. I've never come across cadmium, chronic cadmium toxicity in my practice. So it
Hmm.
depends on which exposure specifically you're talking about. In the specific case of lead, there is a general consensus about what level is safe globally, yes.
Okay. Okay, and sorry, I'm going back and forth, but dark chocolate. So you said a few servings a week. Is there is a duration as well that you would say, maybe minimum duration that would cause an accumulation?
So lead, if we look at the kinetics of lead, basically it's more dangerous for lead to be inhaled versus ingestion.
Oh,
And when we
interesting.
talk about exposure in the firing range or through dealing with lead paint, a lot of that is actually from the lead vapor. So when you're firing in the firing range, you inhale the lead vapor. And even with paint, most of it comes from dealing with the paint. When you're chipping it away, when you're handling lead paint, that causes it to aerosolize or develop lead vapor, and then you inhale it. Most of the toxicity comes from that. Ingestion is still dangerous, but not to the degree that inhalation is. And which is why when we see patients who deal with lead paint or with bullets, we recommend wearing an appropriate mask with a HEPA filter.
Hmm. And coming back to that, is there a duration as well that you would say somebody would
Yes,
need a
so
minimum?
right. So the point of that being that if you're ingesting, that's more of a chronic exposure over a period of time. I wouldn't say there's generally a specific duration that's one size fits all. It really depends on how much you're consuming. It depends on the individual themselves, whether it's a child, a pregnant woman, an adult male, and generally how much they've been consuming over a long period of time.
Mm.
And really, I would say if there is concern for someone who's consuming a lot of dark chocolate for several years, someone who has these kind of telltale lead poisoning symptoms, anemia, constipation, kind of kidney damage, a very simple test is to get a lead uh, blood level and to see what that level is. And if it's within normal range or close to zero, then it's probably not the dark chocolate.
Okay. Fair enough. Fair enough. Okay, so and you mentioned whey protein as well. Can you tell me a little bit more about that as well?
So Consumer Report did a very similar survey on different types of whey proteins, and they found that for some of them, the content was so high that they recommend 0 servings a week, while others they recommend two, 1.5 to 2 a day even is fine. So it really depends on the brand. So I would encourage anyone who's consuming whey protein a few times a week to go and look at which brand they're using and whether that was tested. And I'm not sure about Europe and the UK, but in the US, a lot of these supplements, including whey protein and herbal supplements, they're not tested by the FDA before they become available to the public. So in that case, I would say it's very important to do your research so you can know exactly what you're consuming.
Yeah. I think in Europe there are a little bit more regulations around these kind of things than maybe in the States. But yeah, I'm not sure exactly either how much testing happens. Okay. Right. So heavy metals. Okay, so that's those are all very useful things I think about heavy metals. Um, is there any other environmental exposure you think people should worry about these days?
Yeah, so on the topic of heavy metals, there are some more dietary exposures that we see in the clinic all the time. Another one is arsenic. And they did find some arsenic in dark chocolate, but not as much as the lead and cadmium. And arsenic also is an elemental heavy metal. It's found very frequently in fish, shellfish, seaweed as well. But apart from that, it's found in rice, in well water, that's a big one, especially in South Asia, in pesticides. The thing about arsenic is that there are different forms, though. So there's an organic form and then there's inorganic arsenic. So inorganic arsenic is what you would typically see in rock formations. Sometimes you find that in rice. And organic is the type that you see in fish. So a very common case that I get in clinic is a primary care physician who has tested for kind of chronic fatigue, and they've done a host of battery of tests, and they've included a heavy metal panel in there, and they've included a urine arsenic test, which comes out highly positive, and they're referred to our clinic for further management. And then what we do is we do a very thorough history. We ask about their diet, and a lot of times they'll say that they've had a lot of seafood in their diet, especially where I am in Boston, New England, where it's very common to have a seafood heavy diet. It's important to remember, though, that these regular tests, these urine arsenic tests, they don't speciate, meaning they don't differentiate between organic and inorganic arsenic. So if you have high levels of organic arsenic in the urine, then that's not really going to cause any toxicity in the body. It's the inorganic arsenic that we're worried about.
Okay. So both organic and inorganic arsenic can accumulate, but it's the inorganic arsenic that cause problems.
That's correct. Yeah,
Okay. And organic arsenic is the one that you can get from fish.
that's correct. The fish has organic arsenic, which is
Okay.
not as harmful as
That's helpful.
inorganic.
Okay. Okay. Now I know different fish can have different levels of arsenic, and it depends on where they are on the food chain. I believe sardines and salmon have relatively less. Tuna, sharks. Not that a lot of people eat shark, but they can have higher levels. Um, is there any number you're aware of, safe level of consumption of seafood?
So generally, when we think of seafood, we think of arsenic and mercury as well. So when we talk about sizes of fish, we were mostly dealing with mercury in that case, because the larger predator fish, like you mentioned, the sharks and tuna fish, they will have much higher levels of mercury, swordfish as well. And then more smaller fish, not predatory fish, will have some lower levels of mercury. And that's true for mercury, it's true for other chemicals as well, because larger fish, they're around the water, they're more contaminated, they've consumed more contaminated food, and therefore that's more higher risk. Um, Generally, it's advised to limit fish intake to about 300 grams a week. And more than the amount of fish, it's important on who's consuming the fish. So obviously for children, for pregnant women, that number is going to be lower. And then also depends the type of fish you're consuming. Like you mentioned, the predator fish, the larger the size, you want to make sure that it's on the lower end every week. And especially with tuna, light tuna is better than albacore tuna or white tuna.
Okay, nice, nice. Okay, that's very useful. Um,
I just, if I can just expand while we're talking about mercury, because I feel like there's two other very important exposures that we see with mercury all the time. One is amalgam fillings. That's a very common one. We usually get people coming in who are concerned with their fillings about mercury poisoning because, again, they have these kind of vague symptoms of chronic fatigue. And a lot of times, other practitioners have recommended that they get these fillings removed. And that can be pretty expensive, especially if you have five, six, 10 fillings. Getting them taken out can cost thousands of dollars. We don't recommend people get those removed. Now, older amalgam fillings, they had 50% mercury, 50% other metals. Um, it's important to remember with mercury, there's different types of mercury. There's elemental mercury, there's organic mercury that we see in fish. And with mercury, inhalation is the problem more than ingestion. So in the process of removing the amalgam fillings, the mercury vaporizes and you're actually exposed to much more mercury than if you just let it be. So mercury fillings just by themselves, amalgam fillings, they don't really pose a risk, and we don't recommend that people actually get them removed at all. Removing them can be more harmful than just letting them be. The amount of mercury in there is less than 1% of what's considered an unsafe level. And then the
Mm.
second exposure that we deal with a lot is thimerosal, which is a preservative used in vaccines, in multi-dose vaccines, which contains some mercury, which is now being phased out. And now, at least in the US, we only have it in the flu vaccine and in the tetanus vaccine, but it's not in the MMR vaccine. It's not present in other vaccines. And again, with mercury, we're mostly concerned about inhalation injury, not so much other sources. And the thimerosal, it contains about 25 micrograms, which is around 160 times less than what would be considered a neurotoxic dose. So while we were talking about mercury, I just wanted to add those 2 points for other types of exposures.
Yeah, I think it sounds like for that second, for the last point, that very likely you're probably going to have much more ingestion of mercury just from your food anyway, I think, versus whatever tiny amount gets in through the vaccine. So
Right, and which would be cleared very rapidly and wouldn't cause chronic symptoms for weeks, let alone years or decades.
fair enough. And I think the amalgam, the point you mentioned that having them taken out not only is expensive, but also you're risking actually getting real exposure then as well. Um, i Having said that, though, is there any leaching at all? It sounds like if there is, it's probably been minimal. Is that what you're saying?
It's minimal, very little. And for patients who have maybe 10 fillings and they're grinding their teeth constantly, people who have maybe jaw pain, TMJ, in case we might recommend them to stop grinding their teeth because that might elevate the exposure a little bit. But for people with a couple fillings who don't grind their teeth, they're not going to get mercury poisoning from that.
Nice. Okay. Yeah. So that was very, very useful. Um, Yeah, I think arsenic is definitely something people are worried about quite a lot. And you mentioned South Asia. I do remember seeing a report as well on South Asian groundwater, particularly for Pakistan, where there was a lot of arsenic. So you're saying that's inorganic arsenic, and that's not necessarily such a concern.
So inorganic arsenic is the concern more than organic arsenic. And that is what we see in South Asia and Pakistan and Bangladesh as well, particularly with well water, because when you're drilling deep into the earth and the crust, that's when you're exposed to these types of metal. So anyone who is drinking well water, we definitely recommend that they get that tested, especially if you're living in a place where testing isn't really standard, like South Asia. In more Western countries, pretty much everyone who is using well water does get it tested.
Hmm. And are there safe levels for arsenic?
Arsenic generally, for inorganic arsenic, I would say there's no real safe levels. The more concentrated it is in the body, the more severe the symptoms will be. but ideally the level should be zero.
Hmm. Okay. Any other exposures people could get? Ways it could be exposed? They could be exposed to the inorganic arsenic.
You mean other sources for inorganic arsenic? So rice is a big one. We do see
Hmm.
that sometimes, especially in South Asia, if it's grown in contaminated soil. And then occupational exposures, pesticides are a big one because that's what they add in pesticides to kill insects and bugs. So if you're using fertilizer or pesticide in your lawn, then it's important to check to make sure that there's no arsenic in it.
Hmm. Okay. So you're saying there could be an argument for organic rice.
Well, that would mean that it's not grown with pesticides. So yes, that could probably limit the chances. But then it would still depend on what type of soil it's in, because most of the contamination for rice would come from the soil.
Hmm.
So if it's organic rice grown in non-arsenic contaminated soil, then yes.
Fair enough. All right. And I'm guessing you can't really test the rice, can you?
I would imagine you test the soil that it's grown in, not the rice itself.
Yeah. Okay. I mean, it's not something that any rice companies are checking, are they? Unlikely that you're going to get labeling, say, arsenic free or anything like that.
I haven't come across that, no.
Okay. Yeah, so that's a tough one. I'm
But
just
they
trying to
should
think
be
how do
able
you.
to detect it. They should be able to detect it the way that they detect it in chocolate.
Yeah, yeah. No, I'm just thinking it's, as you said, Consumer Report has tested rice and whey protein for other heavy metals, but it doesn't sound like there's any real way that you could know that your rice has arsenic or not.
Not that I'm familiar with. You could send it off to a lab and get it tested, perhaps.
Yeah.
That's not something that I've done, though.
Hmm. Okay. Yeah. I mean, I suppose it'd be interesting. Maybe for rice manufacturers, they could it could be a label they could use. Hmm. Um. Right. So heavy metals. So that was definitely very interesting, very useful. A lot of the information was new for me. Is there anything else environmental exposure wise you'd feel is important?
I feel one of the biggest concerns for everyone worldwide, which is by far the most concerning environmental pollutant, which affects 99% of the world's population, is air pollution, especially in developing countries, but also in the West. We see it all the time. And this is more of an emerging field over the past 10, 15 years. We've learned a lot more.
Yeah. No, definitely. Yeah, and, South Asia particularly, China as well. Although I believe China's getting a bit better at air pollution than other places. Um, with air pollution, is there anything specifically people should look out for?
Right. So when we talk about air pollution, we're talking mostly about smog, and there's certain within smog, there's basically six pollutants that we talk about: carbon monoxide, ozone, nitric oxide, sulfur dioxide, and then there's particulate matter. And there's two types of particulate matter, 2.5 and 10. And we name those, they have numbers because that's the size. So under 10 microns would be PM10, and then under 2.5 microns, which is very small, is particulate matter 2.5. So I think for the general population, what I really recommend all my patients is they download an app on their phone if they have one. And the way that they check weather, they also check the AQI, which is the air quality index. And that is basically a score of 0 to 500. And it takes into consideration these six pollutants that I talked about. And it looks at all the levels of these pollutants and it compiles a score. So score 0 to 50 is generally pretty clean. 50 to 100, which would mean you should take some precautions if you're elderly or a child or a pregnant woman, or if you have any chronic conditions such as chronic obstructive pulmonary disease, asthma. If it's over 100, then everyone should take some precautions. Ideally, put on a mask when they're outdoors. And when we get up to 150, 200, that starts to become very dangerous levels, where we recommend putting on not just a surgical mask, but an N95 mask. And we encourage people to use HIPAA filters indoors if they can afford it.
there's a lot of very useful points I think you've raised over there. I believe long-term exposure also increases your risk of having a heart attack and a stroke as well. Is that right?
Absolutely. So especially when we talk about how these are absorbed in the airway, and the degree of penetration in the airway varies by the specific pollutant. So when we talk about particulate matter 10, or we talk about sulfur dioxide, these remain mostly in the upper airway, and our body does a good job of filtering it. The nose does a good job of filtering it. When we talk about something like particulate matter 2.5, which is very small, that goes deep into our lungs and into our alveoli, which is where air exchange occurs in the body, where air is absorbed into the blood, and then that blood takes oxygen to the rest of the body. So PM 2.5 goes all the way into the alveoli, it's absorbed into the blood, and then from there it can really go to any organ. And the studies that have come out have shown that it affects our memory, it causes dementia, it can cause Alzheimer's, lung cancer, chronic obstructive pulmonary disease, cardiovascular disease, like you said, hypertension, high blood pressure, it can cause heart attacks, and it can cause epigenetic mutations as well, which basically means that it changes our genetic structure and the way that our body codes for proteins. So really all sorts of chronic conditions, and the evidence is really overwhelming, and we're finding more about it every single year. The WHO recently lowered the safe limit, exposure limit, and we've actually found out that any amount of exposure is harmful to human health.
Mm. Yeah, and it's a tricky one. It's almost impossible to get away from, really, isn't it? Um, I know you said there's a few things people can do. A lot of them might be limited to inside the house, I guess. Is there anything else you think people could to help limit their exposure?
So when we talk about environmental exposures, really prevention is the best treatment for this. And the recommendation is to try and stay indoors when the levels are over 100, 150, especially if it's 200. Try to keep your windows closed. Try to get a HEPA filter if you can. If you must be outdoors, wear a mask. Really try to limit strenuous activity outdoors, because when you're mouth breathing, you're bypassing that nasal filtration system, and then all the pollutants can go much deeper into the lungs. And you're obviously, when you're engaging in strenuous activity, your respiratory rate is high, you're inhaling more of it, and your exposure is higher. So just limiting yourself to that exposure outdoors is really the best way to prevent it.
Hmm. Okay. And just going back as well, you said there's six different types of um, substances that are measured. Does that vary, the different chemicals that you could be exposed to, or is it fairly consistent?
It varies. It varies depending on what the sources are. Particulate matter 2.5 is generally the most concerning. We see that from motor vehicles, from industrial facilities, from household combustion of wood, charcoal, kerosene, and then also from forest fires, which is a problem on the West Coast here in the US. So it depends on what type of source is making the pollutant, and that can really change the AQI and the individual pollutant score.
Hmm. And I'm guessing people might ask this question as well. Is AQI is fairly reliable then, is it?
It's quite reliable, yeah.
Yeah,
I use it
yeah,
myself every day.
yeah. Perfect, perfect. All right. No, that was really useful information on air pollution. I'm sure, as you said, the vast majority of us could be more aware of it. I think at the end of the day, it's probably more up to governments, really, isn't it, to try and do what they can to limit our exposure. It's not, unfortunately, not something an individual can do that much about.
Yeah, absolutely. We can all play our part in trying to reduce formation of these with household combustion, with the use of vehicles. But at the end of the day, like you mentioned, it's up to the government to make policies to limit production on the industrial side, um, with using coal for energy, making sure that there's limitations on how many cars there are out on the road. And you made a great point earlier about how China had really reduced its PM 2.5 emissions, especially between 2010 to 20 in Beijing, through some very strict policies. And I think that's a great example of what other countries, especially in Pakistan and India, where it's a huge problem, can do to implement, to make sure that the population exposure is minimized as much as possible.
Yeah, I mean, yeah, I meant at an individual level, it is hard to do much about it, but at the same time, you have collective power as well, which is how governments change their policy, one of the ways that they can do it. So, it's important to put that pressure on your representatives to get them to do more. That's probably the best way to look after your health, in this instance.
Absolutely.
Yeah.
Absolutely.
Yeah. Right. Is any other relatively new exposures that people should also be concerned about?
Another one in the news that I get asked about a lot are forever chemicals, also known as PFAS, which stands for polyfluoroalkyl substances. These are man-made chemicals. They're also known as forever chemicals. They're used in non-stick cookware, in pots and pans, in carpets, in industrial processes, in fast food packaging, and also they're found in firefighting foam, in plastic water bottles. So really, they're all around us. And recently, you must have read this in the news, it's been found in the blood and various organs. They're called forever chemicals because they stay in the body for years, even decades. And the exact health impact is unknown at this time. There have been some studies linking it with uh, hyperlipidemia, which is basically elevated cholesterol, with various types of cancer, including breast and testicular cancer. They're known as endocrine disruptors because they can disrupt the hormones, which is why we think they cause testicular and breast cancer, thyroid disease, GI diseases like ulcerative colitis. But the evidence is limited and it's mixed. So we don't really know the true extent of the damage that these substances can cause. Right now, there's no reliable way to test for them. Some of these substances we can test in the blood, but since this is a more newer environmental concern, there haven't been as much studies done to determine a safe level in the blood for this. And so really the recommendation that I tell people, there's no real testing for it. There's no way to get it out of the body. So the best thing, like most other environmental exposures, is to limit your exposure to it. Try to avoid using nonstick cookware. If you do use it, try not to put it in the dishwasher. Wash it by hand. Limit takeout food, generally for cardiovascular risks, but also if you're going to get takeout food, maybe don't get it in those plastic lined takeout containers. Um, if you have carpets upholstery that is damaged, then that's more likely to cause exposure to PFAS, to toss that out. Those are generally some steps that we can take. And if there's known water contamination with PFAS in your neighborhood, then change your water source and avoid drinking water from plastic bottles.
Yeah, that's very interesting. It's one of those areas which is so new. There's still so much debate about whether it's actually doing anything or not. Um, I think what you're saying is because there isn't enough information, and so far, whatever information there is suggesting that there is some cardiovascular risk potentially, that we're probably best off just limiting our exposure altogether. Is that right?
Right. And no need to get too carried away with it since we don't know too much about it yet. But if there are small steps that don't really change your lifestyle too much, like using plastic containers or plastic water bottles, then my advice would be to try to limit that as much as you can, as much as you reasonably can.
Yeah, I don't know if you saw this. I think it was a few years ago. There was a scandal in France where a very famous French bottling company, which was selling extremely pure, mountain fresh, pure water, was actually found to have their supplies contaminated with PFAS as well.
I did not hear about that, but that doesn't surprise me.
Yeah, so it's actually a airport which was nearby, which was using the fire retardant on their airstrips, and that's how it got into the bottled water, basically. So yeah,
Yeah, the aqueous firefighting foam is notorious for containing PFAS, and firefighters are really exposed to PFAS through that. That doesn't surprise me at all.
yeah. So yeah, no, it's just ironic how a lot of people who probably buying this water thinking that it's, extra healthy really wasn't. So, right, so PFAS, and unfortunately, there's not much you can do about it if it is there. Um, am I right in thinking there's some people who are suggesting you can remove some of these kind of things from your blood?
There's no known well-established way of removing it. Like with some heavy metals, there's chelation therapy, oral, intravenous, intramuscular, that encourages those substances to be excreted from your body, but there's no real reliable, documented, well-known way of similar therapy for these forever chemicals or PFAS or microplastics.
Okay. Okay. Yeah, I think um, or somebody is saying that you can remove microplastics from your blood. Is that something I believe there are some people who are
I haven't heard of it, but
doing
I'm
that.
sure they're researching it.
Hmm. I think somebody's made a device, and I'm sure there were celebrities who were getting it done, and there's a bit of that happening. Yeah. But it's interesting you came back to the heavy metals. So you're saying there's not much that we can do to try and remove them from our system. Is that right?
For PFAS or for heavy metals?
Heavy metals.
For heavy metals, it depends. So if they're usually when we look at environmental exposures, we look at acute toxicity and chronic toxicity. With chronic, we're thinking low levels of exposure over a long period of time, which causes chronic symptoms and it slowly accumulates in the body. With the acute exposure, we're looking at a short period of time, but a very high exposure level. So in acute exposures, usually we can do chelation therapy for things like lead or for arsenic. But for chronic exposures, we don't do chelation therapy. We just avoid uh, the exposure because the exposure itself is at such a low level that that's not something that we typically do. And a lot of times I'll have in my practice people who have gone to other providers first. And something that is very popular in functional medicine that I've seen is provocation testing, which is basically the use of a chelating agent to first mobilize chronic stores of something like lead in the bones out into the blood. Then testing the blood, obviously the level will be much higher because it's been mobilized from the bone. And then treating it with the chelating agent, which really isn't standard of care. For chronic exposures, what you want to do is you want to limit your exposure, and then gradually it will be eliminated from the body.
Right. Okay. Okay. I think I remember seeing a study or two where there's a suggestion that sweating can help to remove some heavy metals. Have you heard of that?
Not necessarily sweating. I can't imagine advising someone to sweat any types of heavy metals out. That would require a lot of sweating and would have its own physiological risks.
I think
But
this
most
was
of them are.
yeah, I think this was around sauna use.
I'm sure there's some studies out there, but I haven't seen any of those. Usually they're renally excreted, and then depending on the metal.
Okay. Interesting. All right. I think we skipped microplastics. We did sort of mention them there in between. What do you know about microplastics?
So microplastics, I would give the same advice as PFAS. Microplastics are basically any small plastic chemicals. They're usually down 5 microns or smaller than that. They vary in size. And again, it's very similar to PFAS where they can stay in the body for a very long time. Anything that's made of plastic can expose us to microplastics, especially if it's plastic that's being heated and consumed, water bottles or food storage containers. It can't really be detected reliably in our body, at least not in normal clinical screening or in a primary care setting. And there's really no way to remove it from the body as well. And again, the harmful effects are currently being studied, so we don't have any reliable studies that can show a clear association between exposure to microplastics and a specific disease. But again, my advice to everyone is to try and limit the exposure as much as reasonably possible.
Yeah, no, I think that was a great overview for, I suppose, everybody, the general population. These are the kind of substances that are common, heavy metals, PFAS, microplastics, and air pollution that we should all be aware of all of the time. And as you said, it's just simple, small things that you can try and do to try and get them out of your environment, and yeah, that's all we need to do.
Yeah,
Yeah.
I would just say that when it comes to environmental exposures, for people not to be too concerned about specific symptoms, but to think of it as more in terms of the sources that they're exposed to, because a lot of the symptoms that we see can be caused by more common chronic conditions.
Great, lovely. Thank you. Thanks so much.
My pleasure. Thank you for having me.
Always great talking to you.
Likewise.